Hello, good morning. Today I'm going to be doing an IV for my patient who needs a blood transfusion because her hemoglobin came back too low. So I've checked my orders before entering the room and I've gathered my supplies. I have my IV kit right here. I have my 20 gauge needle and my IV extension set. I have a pair of gloves and I have my saline. I'm going to go ahead and walk into the room, introduce myself, go ahead and cleanse my hands. And Mrs. Simmons, good morning. The doctor has ordered an IV for you this morning for your blood transfusion. I was wondering if you can please verify your name and date of birth for me. Okay, thank you, Mrs. Simmons. So I'm just going to go ahead and set up my supplies here and I'll walk you through the procedure as we're going. If you have any questions at all, go ahead and let me know. My name is Aurelie and I'm going to be your nurse for the day today, okay? So once my hand sanitizer has dried, I'm going to go ahead and put my gloves on. I'm going to go ahead and open my IV kit. I'm gonna set my Tegaderm. I'm gonna just peel back a tiny bit just so I have it ready on the side for me here. I'm going to apply my tourniquet onto the 4 inches above where I plan to insert my needle, and I'm looking at Mrs. Simmons' arm. I see a good vein here on the AC. So I'm going to go ahead and apply the tourniquet. We want it to be a little snug, but not too tight. I'm going to go ahead and feel for a pulse. Okay, that's good. And I'm going to go ahead and cleanse the skin without retouching the surface again. I'm going to allow that to dry. I'm going to have my tubing on the side ready for me. And what I want to do is I'm going to go ahead and flush some of the saline, make sure that it's gotten all the air out. And now I'm going to get my needle ready. I want the bevel to be facing up, and I'm going to tug on the skin. Make sure it's nice and firm for me, sturdy. I'm going to go in at about a 30-degree in, and once I see that blood return, I'm going to go ahead and advance just a tiny bit more, and I'm going to go ahead and advance the catheter. And then I'm going to press for my safety. I'm going to go ahead and put some pressure above and release the tourniquet. And now I'm going to attach to my tubing. I'm going to pull back to see if I have some blood return, which I do. And then I'm going to go ahead and make sure there's no resistance when I'm flushing. Okay, we're good. And now I want to go ahead and put my Tegaderm over, making sure that you're able to see the catheter. You don't want to cover that up. You're going to have that. And make sure your IV is nice and secure. And go ahead and remove this. And with a little piece of tape, I want to secure it. Without covering the IV. And then you want to make sure you have your little lock on, saving lock. And then I want to make sure that I write my initials, the time, it is 1 p.m. and the size of the gauge is 18. And we're going to go ahead and put that over onto our top of our Tegaderm. Make sure it's not covering anything there. Okay, Mrs. Simmons, so we're gonna get everything ready with the lab, and once we have your blood picked up, we will come in and start the procedure for you, okay? Do you have any questions for me before I go? No? Okay. If you start to feel any pain on the IV side, go ahead and let us know right away, okay? So I'm gonna go ahead and clean up my things. And now, after she's received her infusion and she's ready to go home, I see that the doctor has put in new orders for her for us to remove the IV. She no longer needs it. So at this time, I would go ahead and come in again into the room. Hi, Mrs. Simmons. Good afternoon. I'm back. I'm glad that your treatment went well. The doctor has ordered for us to remove your IV. Do you have any questions for me before we get started? No? Okay. So what I would do is I would come in with the alcohol wipe. And I have some gauze with me. And what I'm going to do is I'm going to make sure that I verify Mrs. Simmons' name and date of birth. Mrs. Simmons, can you please verify your name and date of birth for me? Thank you. I've provided privacy. I've closed the curtain. I'm going to go ahead and put my gloves on. And I'm going to make sure that I look at the skin. Everything looks, there's no redness. It's not hot. Okay, Mrs. Simmons, so it is a little uncomfortable when I remove the IV. I'm going to use this alcohol wipe just to kind of help remove the Tegaderm a little bit easier without irritating your skin. It's a little uncomfortable when it pulls on the hair, okay? So I'm going to carefully remove the Tegaderm. And I'm going to grab one of my gauze and I'm going to apply pressure as I pull out the catheter. I'm going to apply pressure for about 30 to 40 seconds on there. And I'm going to make sure that my catheter is intact. It's not broken. Nothing was left behind into the skin. And as I have pressure on here, I'm going to go ahead and toss that into my container. My goodness. Okay, and then I can go ahead and remove this. Now I can go ahead and apply some pressure with the clean gauze and go ahead and put some tape over it. And then I would, Mrs. Simmons, your call light is right here. If you need anything, please let us know. If you see that it's any blood starts to seep through, go ahead and let us know right away as well, okay? But I see that it has stopped bleeding. Here's your call light. If you have anything or need anything, please go ahead and call us back. One of the steps that I missed when I started the IV was putting when I activated the safety, I can go ahead and put that in my sharps container. So I would have done that as well, okay? Thank you so much and I appreciate it. Have a good day.